Hello, my name is Jasmine Montgomery and I'm a PhD candidate at James Cook University in Australia. Today I am presenting on a scoping review of forced separation between people and their pets in crisis situations that was recently published in January 2024. I'd like to thank my co-authors and advisors, Associate Professors Janice Lloyd and Ming Liang, and also my PhD mentor, Dr. Diana Mendez, for all their hard work, support and dedication to improving outcomes for people and their pets. Just a bit of background about myself. I'm a social worker in Australia and I worked in the health sector before going on to research. My love for pets and my compassion for people in need led me to start a PhD project in the area of forced separation from pets with James Cook University. I completed this scoping review as the first part of my PhD study, and as a result of this scoping review, I'm currently narrowing in on forced separation from pets in domestic violence situations. So please see my email at the bottom and feel free to contact me with any information or questions. Today I will be presenting on the scoping review with an introduction, a methods, result and discussions, and finish with a conclusion. When people are faced with situations of potential loss or forced separation from their pets, such as a disaster, homelessness, or domestic violence, this can lead to considerable distress. The scoping review mapped the concepts, evidence, and impacts of forced separation between people and their pets in crisis situations. 42 articles on the human-animal bond and situations of separation revealed death and loss of the animals were prominent, significant psychological distress, and an increased risk to safety in people were found. Major themes emerged of human as superior to animals and responsibility, and these findings will be discussed in more detail throughout the presentation. The ARCSI and O'Malley framework was used to guide the process of the review, and it followed the PRISMA guidelines, which included detecting and selecting articles, extracting the data, and analysing and reporting the findings. The databases search were Medline, PsycInfo, Scopus, Sunal, and MCare. The inclusion criteria consisted of peer-reviewed journal papers written in English on adults sharing a strong emotional attachment with a pet and who had experienced a situational change or event. All types of methodologies were included, and this was to allow different traits of measuring situational change and the human-animal relationship. The most common actions and outcomes were analysed in the scoping review, and the most common findings consisted of an increased risk to safety to both people and their pets, an increased risk to psychological well-being, and increased feelings of distress, grief, and trauma for people, and outcomes, sadly, death and loss of the pet. The main findings for natural disasters found that people were often forced to abandon their pets to flee to safety, and for those who were able, evacuated with their pets. In homes with multiple animals, people were often forced to choose which animals to evacuate with and for those to leave behind. And so for the pets left behind, people would take significant risks to return during danger periods to rescue them. For homelessness, people who were homeless would decline accessing non-pet friendly shelters or accommodation to stay with their pet. People that were either homeless or at risk of homelessness were often forced to rehome their pets in order to find accommodation. And people would delay seeking health treatment if they were not able to find supports for their pet. However, for those that were homeless and were able to keep their pets during homelessness, positive health benefits were found, such as feelings of comfort, companionship, and safety. The most common findings across the domestic violence category found that people were willing to delay leaving their relationship to protect their pet, and inevitably were forced to leave their pet with the abuser. This resulted in an increased risk of animal abuse and coercive control. Pets were often rehomed or euthanized because of domestic violence, and there was an increased risk of children in the home mirroring the abusive behaviour towards the pet. How people value their pets and the level of responsibility felt for them influences the risks that are taken and the treatment of them. So pets were taken into consideration only after a problem was recognised by the person amongst services and policy programs and was seen as a risk to people that required mitigation strategies. There was also a lack of shared consensus as to where the bulk of responsibility falls: the individual, the community, the services, or the policymakers. The perception of humans being valued more than pets, human superiority, complicates help seeking, with a flow-on effect of a lack of trust in service provision and fears of repercussions of forced separation between people and their pets. Human values of superiority over pets can also be noted through structural systems, with Western countries such as the UK, Australia, New Zealand, and the US considering animals to be the legal property of their owners. This has implications for services and mitigation strategies when developing policies, programs, and safety planning. The lack of trust can be justified when services, policies, and programs are designed to prioritise human safety above all else. In the US, they had implemented the Pets Evacuation and Transportation Standard Act after Hurricane Katrina, and this allowed financial aid to be distributed on federal authority at both state and local levels to support with needs such as pet-friendly transport and temporary shelters. There's only been one evaluation of this PETS program, and this indicates that the PETS program had little improvement. While there are limitations to just one study, this can demonstrate that there's more to be done than transport and accommodation with pets. Other logistic factors such as awareness of shelters, perception of threat, consideration of the human-animal bond, and the availability of resources to evacuate safely needs to be considered for people and pets to evacuate safely together. In the domestic violence category, a mitigation strategy included the Sheltering Animals and Families Together SAFE program, which was developed in the US, and this allows women, children, and pets to access accommodation as a family unit. Australia has followed the US in implementing this program. However, few programs have been implemented and are logistically inadequate across the US and Australia. The US and Australia also provide time-limited fostering programs for pets while people flee domestic violence and seek refuge. People may be unaware of such programs available for their pets and are often informed after they've sought refuge. While these programs are important in assisting the well-being of pets and allowing people to seek shelter, they inadvertently perpetuate forced separation from pets. Other factors need to be considered when developing policies and programs, including the overall health of the person and the animal, financial situations, children and their concerns for the pet's welfare, logistics, availability and awareness of programs, and the exploitation of the human-animal bond during and after leaving the abusive relationship, and permanent, affordable, pet-friendly accommodation. And this includes recommendations for affordable pet-inclusive accommodation for those who are homeless or at risk of homelessness. The literature from the scoping review provided evidence of the increased risks of safety and psychological well-being for both human and animals when people are forced to separate from their pets in situations of natural disasters, domestic violence, and homelessness. An intertwined theme of human superiority and responsibility emerged, which suggests that people and animals are impacted by values such as humans as superior and the lack of consensus for shared responsibility of the welfare of the animal. This embedded anthropocentric view influences risk-taking behaviours, psychological distress, and loss or death of pets, and a lack of trust in help-seeking at times of crisis due to potential repercussions of forced separation. The significant negative psychological impacts on people underline the deep connection between humans and animals and highlight that when pets are not given equal consideration in policy and programs, and people and their pets are not provided with the sufficient support to stay together, the wider community, including health and animal welfare sectors, may be impacted as the recovery process is hindered. Raising awareness across communities about the implications of forced separation is required to encourage policies, programs, and legislation to include pets and take collective responsibility for the welfare and safety of both people and pets in crisis situations. For further reading and further information, you can Google a scoping review of forced separation between people and their companion animals by Montgomery, Liang, and Lloyd. Thank you for taking the time to hear about forced separation from pets.